Hi, my name is Carly McFarland, and this is my Literary Talks presentation on teaching nurses how to teach. So, a little bit of an introduction. How does this relate to me? Currently, I am a senior nursing student at Mount Union, and I wanted to focus on nursing as a whole, being nursing students and those who are actively practicing as registered nurses. Um, and then personal experience with this. So, my topic relates to teaching nurses how to teach, being able to teach nurses how to give patient education in the hospital. Personal experience would be that currently I work as a nursing tech at Salem Hospital, and one of our job descriptions is that we have to go and we have to strip the rooms down when a patient gets discharged. And most of the time, I will run into the situation where I'm throwing away all of the educational pamphlets and all of the discharge education that the nurses have given these patients, and the patients are just leaving them and I'm throwing them away. So I picked this topic in order to better enlighten those around us about how we can combat this lack of education that's going on in the hospitals. So, what is the problem? So, in a article called Nursing Teaching Nurses to Teach, it's an informational article published by the Nephrology Nursing Journal, and the author is Beth Ulrich. She writes that teaching requires focused practice in order to attain mastery. A lot of times, these nurses don't know how to teach these patients because either they were never taught how to teach somebody, or they're just expected to know all of this information offhand and they don't really have the resources to give out this education. Um, she says that nurses need to have a good understanding of health literacy and education literacy in order to provide adequate patient education in the hospitals. So, diving a little bit deeper into the problem, there's three main topics that I chose to discuss. That is, nursing students lack receiving education on providing education, meaning we don't have classes that teach us how to teach these patients, even though once we get into the workforce, we're responsible for pretty much most of the patient education. Surgeons and doctors, they'll come in and they'll explain the disease or the diagnosis and like tell the patient what to do, but in all, we're the ones who are with the patients the most, providing like the closest care to them, and we're the ones who do the discharge education before they get discharged to go home. In a article called Nursing Students' Understanding of Health Literacy and Health Practices, written by Monangatir and Marika, it states that nursing students have a good understanding of health literacy, but more effort should be applied to maintain their understanding during and beyond the point of graduation. So, the lack of nursing education that we're receiving in school contributes to the problem within the workforce that nurses don't know how to educate because we never learned how to do so in nursing school. The readmission rates are increasing because of these patients not knowing what to do when they get sent home from the hospital. Because when a patient gets sent home from the hospital, they are still not 100% better. They still have to focus on their illness or disease or diagnoses, and they have to treat those at home as well. So if we're not providing enough patient education on how to treat these things and steps to do so they won't end up back into the hospital, the patients are just going to keep being readmitted to the hospital, and that's not a good thing. This article was also posted by the BMC Nursing website, which is an open access website, and it contains peer-reviewed journals, so this is a credible source. Readmission rates are increased. I already talked about that. The fact that if patients don't know how to take care of themselves when they're out of the hospitals, they're going to be readmitted and readmitted for the same reasons. There's also barriers within the hospital that prevent health and discharge education. So, like I said before, nurses lack an understanding of how to give this education, but there's also these barriers that may contribute to the fact that nurses aren't giving enough education. So some of those barriers within the hospital would be interpersonal role ambiguity, high patient to staffing ratios, and low prioritization of education. So first off, interpersonal role ambiguity. These nurses don't know The nurses don't know what the doctors are teaching the patients, and the doctors don't know what the nurses have said. The doctors and nurses don't know what the surgeons have said. So there's just a lot of things that may get left out of teaching because they think someone else had already covered it. In an article written by Chi and C called Missed Nursing Care in Patient Education, this was an article written within the Journal of Nursing Management, which is a accredited nursing journal. It states that role ambiguity is between the levels of nursing concerning their roles in patient education. So they just don't understand who is teaching the patient what and when and why. So a lot of education gets missed out in the long run. In order to combat role ambiguity, there is an article posted by Negley to the Mayo Clinic Cancer Center website, and it focuses on the need for interprofessional collaboration within the hospital. This article is called Building Collaborative Nursing Practice to Promote Patient Education. So it basically states and goes through this whole process in which there was a study done on giving the roles in the hospital more clarity on what is going on with the patient's education and the patient's care plan and all of the things about the patient. So this article focuses on the need for collaboration and communication within these fields in order to give out that patient education that is needed for discharge. Back to Chi and C's article of Missed Nursing Care in Patient Education. So a lot of times patient education isn't a priority in the nursing care. There's a lot of other things that the nurses think they should be doing that's more important. And granted, there is a lot of things that are more important in the hospital. So high patient to staffing ratios would equate to this because the nurses do not get to spend enough time with each patient if the staffing ratios are high. So a nurse could have 6 patients on a floor instead of having 4. You would be able to spend time with these patients, get to know them, get to know their holistic health, and you would be able to provide better education for these patients. And then in Montgomery and Marika's article from earlier that I had mentioned, it states that the good understanding of health literacy of nursing students is not supported by good health practices, which can send conflicting messages to their patients. So a low prioritization for education, like it says on the slide, it states that basically we're not receiving education for educating patients. Nursing students need to require a good health literacy, which we do obtain through our classes. However, it's not transferred into the workplace because we don't know how to educate our patients and we don't know how to describe what we are doing and why we are doing it. And this can send conflicting and confusing messages to our patients. So, raising health literacy. There's 4 things that I focused on that we can do in order to increase our health literacy on patient education. So there's educational courses on education. In an article called Teaching Nurses How to Teach, written by Lamiani and Furry, this was posted to the Science Direct's website within the Journal of Patient Education and Counseling. So this article talks about the fact that nurses lack formal training on patient education, which needs to be combated with classes that can be done in nursing school or in the workplace during skills workshops. I know personally, my hospital, we have skills workshops to make sure that we are taking care of our patients correctly. However, we do not have any skills workshops on how to educate our patients. Um, and in the article, it specifically states that trainings based on patient-centered model and interactive learning methods should be implemented for nurses to improve their ability to deliver effective patient education. So just basically going off of the fact that we need to teach these nurses and keep them up to date on how to give education to our patients. Incorporating technology in the Wolters Kluwer website, which is a website that Mount Union uses for nursing. We get a lot of our resources and our textbooks about this. They posted an article of 5 strategies for providing effective patient education. And it says that we need to take advantages of educational technology. So having that technological literacy that has made patient education material more accessible. So using already created diagrams, already created pamphlets within our patient education. So that way we can lessen the stress of the education for the patient, because a lot of times discharge education can be very overwhelming for the patient, and that's why half the time I'm throwing away their booklets on education in the hospital because they don't think they need it. They also state that in the Wolters Kluwer, it states, don't simply hand the patient a stack of papers to read, review them with the patients to ensure they understand the instructions and answer questions that arise. So actually sitting there with the patients and reviewing education with the patients instead of just handing them a stack of papers will really affect the health literacy in the community, and it will also prevent readmission rates from rising. And then the nursing curriculum change, there just needs to be more classes on how to educate people properly. We do a lot of education in our major. However, we're not learning how to do education. Um, and yeah, so that is my presentation. I do think Mount Union has been doing a great job at teaching us how to educate patients. I'm currently doing a education project right now that incorporates the education majors as well as the nursing majors. It's a collaborative project we're doing where we teach middle schoolers about health literacy. So I think that's really awesome that Mount Union has taken the step to do this. However, I know there are other places out there that do not do this. So that's why I think it needs to change. And thank you. Here are my references that I used in all of the journals and links. Thank you.